Well, hello, class. This is Dr. Turpin. Wanted to record you just a little bit of detail from these two chapters, chapters 8 and 9, related to communicable and non-communicable disease, so that you'll have this after class. We will probably spend the biggest part of class with you doing some group activities related to investigating some communicable diseases and investigating some non-communicable diseases that may be common to the counties that you may be considering for part of your full health assessment. And in that way, you're kind of using some of this chapter and applying it in practice a little bit better. So I'm going to try to just run through several of these slides real quick. And I will try to summarize some of this a little bit after we get done with our group activity, but just so that you have a little bit of something to listen to, maybe a little bit more detailed after the fact when you're studying for our next exam. So this just gives you kind of an outline of communicable disease. We've already talked about this in class before, how a lot of these transmittable diseases or infectious diseases were the leading cause of death, and through a lot of work with education and making sure people understood how disease was communicated and prevention methods, in a lot of ways, communicable disease still continues to be a concern, but it's not as much of a leading cause of death as it once was. And so a lot of the interventions that have been put in place in terms of prevention, all different types of prevention strategies, have done some good, whereas there's still a little bit of difference in the types of diseases that now we have issues with than we did in the year 1900, for example. This is just kind of a list of leading causes of death related to communicable disease, and you can kind of see why there's sort of a huge focus on some of the discussions with patients in the hospital setting that come in with pneumonia, as well as influenza, which also affects the respiratory system. And then with children, diseases that are like RSV and respiratory type diseases, because they're some of the most complicated ones in terms of being deadly. And so it's really kind of important to, always kind of keep that in mind when you're thinking about patients that you might see in the hospital setting, and how to, while you've got them there, irregardless of what their admitting diagnosis is, if they're at high risk for potentially developing an infectious respiratory disease, to provide vaccinations or provide an assessment to see if they need those prior to them leaving the hospital. So currently, public health's responsibility is to, both at the local level and then globally across the world, really it's their responsibility to monitor and do surveillance of diseases. So make sure that you know these three terms: epidemic, which means a significant increase in disease; endemic means the numbers of disease within a specific population; and then pandemic, which means a global outbreak of a particular communicable disease. And why is communicable disease an important thing for us to focus on? We're caring for patients. We have a great opportunity to make sure that they don't have debilitating or life-threatening conditions that result from communicable disease. If we can institute preventive measures that help less of the population be affected by these diseases, great. And then even in our regular care, whatever the agency might be, making sure that we are wearing the exact personal protective equipment that we should be, to not only protect ourselves, but to be able to, and coworkers too, but also as we go taking care of more than one patient, ensuring that we are not, part of that transmission chain of a communicable disease to other people. We also usually are often responsible for cleaning of equipment, whether that's going in and out of an isolation room and cleaning a glucometer before and after, or making sure when somebody's discharged from the hospital that we always ensure that the equipment that was used on one patient is fully cleaned and if necessary, sterilized before being used on another patient. So it's important to kind of understand communicable diseases at two levels. First, how are you as a nurse handling a communicable disease or the prevention of or helping ensure that diseases are not transmitted at the individual level. But then from a population health and a public health standpoint, you're concerned with globally how diseases in general are controlled in terms of communication from one population to another. The main key element, I guess, in communicable disease is knowing what is that infectious agent, who is a higher risk person than another once exposed to have more severe complications. Also knowing the actual mode of transmission, because you have to, in prevention and protective type isolation situations, it's all well and good if you've got all the gear, but if you're using the wrong gear because you're not understanding the mode of transmission, then you may have some things that you're using, but it may not be the effective thing to halt the transmission. And then understanding prevention at the individual level, for future encounters for somebody, prevention that would be even discussed at well visits with people in a public health arena, as well as treating communicable diseases when someone does come down with the disease. So that's a lot for nurses to be responsible and know. It goes to say that because of improvements in technology in transportation, people from all around the world have had barriers in geography kind of limited. So people are a lot more connected and coming in contact with each other than ever possible in years past. So with that comes a lot more potential exposures to communicable diseases. Again, infectious respiratory disease continues to be a major public health issue. And if you pull and look at isolation cards in the hospital, when you go to clinical, you might find the isolation card and just see, or you can go online and actually pull up the actual posting signs that normally go on doors in an isolation room. If you look on the backs of those cards, they generally are going to list all the diseases that typically would be pretty commonly associated with that kind of transmission route. So with respiratory, you're concerned about things that often are going to be droplet precautions and or airborne precautions, which are two of the biggest issues. And there is a big difference between what kind of gear that you wear for droplet precautions and what kind you do for airborne because of the size of the particle in the air. For diseases like tuberculosis, the particle is so tiny that when you are having a mask on, a regular mask, it does not filter the air enough to prevent those from being inhaled. And those are germs that linger in the air, and they're not just connected to droplets. So the potential for exposure in a room is a lot more with diseases that are airborne versus just droplet precautions. But these are a few of the key ones that deal with infectious respiratory. Probably the more prominent ones are chickenpox, diphtheria, rubella, and influenza. And what we have found through the years is the more that vaccinations are used, there is a significant decline in those diseases. There is a couple of different video clips in your As You Learn course that I would encourage you to watch. And it really kind of gives you an idea of what are the pros for vaccination, and then what is the many members of the public have varying views on vaccination. And so as nurses, we really have to understand what some of those reasons for lack of vaccination are, and be able to work with our patients on that. So this is some diseases that are considered communicable disease at the global level. Malaria is one of those because it is spread by an infected mosquito. You see this more in subtropical areas, and it affects greater than 1/2 of the world's population. So that's just unbelievably large amount of global communicable disease. HIV/AIDS is also one because you can go 15 years after being exposed before really getting the more serious immune deficiency part of the disease. And because of that, a lot of patients, 20%, are totally unaware that they've even been infected. And these are some of your common factors in terms of 25 to 44-year-olds in the African and Hispanic descent population are most prevalent. And these are strangely that there is a rise on with this disease in older adults, just because they may still be sexually active, but not really aware that, there's no need to use birth control. And so some of the things that would be preventive are being not worried about because of not a need to worry about pregnancy. There are Healthy People 2020 goals for HIV and AIDS. They want to reduce the number of people who become infected. They also want to increase access to care for people who have and are living with HIV, and then look at how to change this certain segment of the population being more likely to become infected versus, kind of make that more normalized and reduce that disparity. Diarrhea disease is also a very large portion of communicable disease. The rotavirus is one that is often common in children and can be very deadly, particularly with children under the age of 5 years old. And there was a vaccine that was introduced in 2006, and there's been a big decline in hospitalizations and deaths of young infants because of that vaccine. Diarrheal infections are really spread by bacteria, virus, protozoa, waterborne, things like cholera, and then foodborne, which you hear people talk about, a restaurant and people came down with E. coli. It's because E. coli was found to be growing in the food. There are several diseases that have been eradicated, essentially. Smallpox really no longer exists because of vaccinations. Polio and the guinea worm are nearly eradicated. There are some newer emerging diseases like severe acute respiratory syndrome, West Nile virus, and then re-emerging diseases like malaria